See if Neuropathy is genetic. All right.
Neuro is genetic.
All right. Go ahead. So David's going to discuss it. So go ahead.
For sure. All right, 51-year-old woman, back in 2021, she had acute painless bilateral vision loss while visiting Indonesia. It was associated with numbness on her face, her jaws, and her legs. While there, she received high-dose IV steroids to try to save her vision. But 2 years later, she comes to Dr. Cohen, and along with some Parkinson's symptoms, she has NLP vision in both eyes.
Oh, yeah, we can get into that. Yeah.
All right, David.
And here, David,
Describe what you see.
this will give, this gives a minute. You can move the mouse and that'll give you something to point with.
All right.
I think it's there.
So starting with the nerve, I think it looks a little pale to me. Is that good?
That work.
Good.
The border is sharp. I don't notice anything notable with the vasculature. The macula looks normal to me. So all I can say is it looks like a pale nerve.
Do you know what eye this is?
Right eye. Oh, excuse me, left eye.
Anything else here?
Looks similar with, is that PPE?
The
Point to what you're talking about.
The darkness here. I think that's a benign finding.
oh, peripatetic atrophy. Did it early stuff.
Otherwise, looks the same as the other eye.
Now, one thing about the nerve, is it cupped? Is it, because that's when you look at nerves, like what can, you can't say that much about them. Is it small? Is it, do you think it's cupped or just not cupped?
I don't think so.
Go back to the other one, it's got a better,
It's very small cup. I think.
yeah, you can see a little bit of the cup there, can't you? Right at the vessels, it's minimal.
Yeah. So it's interesting. It's not a cupped nerve, it's just a pale nerve.
Yeah, pale without cup. And then anything in the periphery?
I don't believe so.
I agree.
It's hard to take pictures of NLP eyes. It's nice having this camera.
Yeah.
But they don't know where to look.
There was a woman in the young woman in the ER yesterday that had ocular albinism, and she like couldn't control her eyes because she just like didn't know where she was looking. She's been blind for so long. It was really hard to do. And she came in with vision loss after trauma.
Oh, really?
Like some flashes, and so trying to do peripheral retina exam was.
Oh, God, it's so hard. Yeah.
All right, so OCT nerve, anything jump out to you?
Everything looks rather thin, so
Good.
global loss of.
It's interesting, the thickness there. Can you read the thickness?
I tried expanding it, but
Yeah.
the quality of the image itself is poor. I think one of them's like 29 and the other's like, what was it? 30 or
29,
something.
17.
Yeah, the middle circles. It looks like a 29 and a 28, 28 and 29, 28 in the left. Which I didn't think it would go that low. I thought the floor was like 30 or 40, which is the tissue. So I thought it was interesting. It went below 30.
This is vertical cut OCT through the macula.
Nothing jumps out at me. The last case I wanted to ask about this haze in the vitreous, or is that
It's just kind of healthy vitreous. Yeah,
And the horizontal cut provides more insight, and you have to see a few more of these to kind of know what to look for. But usually, as you get closer to the nerve, you'll see thicker and thicker RNFL and ganglion cell layer. But it's good to compare with the normal. But here, there's just loss of it, which is consistent with the OCT. And same, this is a vertical cut in the left eye. Horizontal, it's the same sort of loss. So just like a broad diagnosis for what we would call this. Like if you want to just succinctly say what we're looking at in both eyes, what would you say?
optic nerve atrophy?
Yeah. Great. Bilateral optic atrophy. And then everyone help out David.
Yeah. People help out.
Broad differential.
She's good.
Non-arteritic syphilis,
Mhm.
B12, folate deficiency.
vascular.
She needs that vitamin A. Inherited.
So this is a differential for unilateral. This is a differential for unilateral optic atrophy, but also like a few of these are highlighted that more likely to be bilateral, or have the potential to be bilateral. And I won't go into each of them, but
Well, it's not bad quickly. I mean, some of them, some of them are painful and some of them aren't. I mean, sort of the things you would ask.
yeah, so I mean, papilledema, you'd expect to have headaches or other symptoms of increased ICP. PION, you'd see in the setting of significant blood loss or hypovolemia. Demyelination, maybe if you can have sequential optic neuritis or have NMO and have bilateral. Any sort of medications and ingested substances, which we'll delve into a little more. And then autosomal dominant optic atrophy and levers. Those are usually you'd see like it's usually sequential rather than simultaneous, and then significant trauma could cause this as well.
Thanks.
And then history is important. So I don't know if you can tell us more about what happened in Indonesia. Because
It's a beautiful picture.
yeah, that's great. What are you able to fill us in what actually?
Oh, she said, did I tell you? I thought I told you.
No.
Oh, gosh, I should have put that in there. No, she in Indonesia, she was drinking vodka. She went blind after drinking some vodka.
Oh, it's methanol.
Yeah, so she was out and then she went right in and
Alcohol.
they got right on her and I think it was just too late. She went in, I think she must have passed out. She must have been doing other drugs.
Yeah.
Drink it too? Did they have any vision loss?
That's what I don't think so, but I don't know if she knew that. She was not very with it. She unfortunately, she was pretty fried. From
By
whatever
the
she drank.
methanol.
Yeah,
You know, they used to
she
be,
went right in. I think she went right in and they hit her with, that's what the steroids, they hit her with a gram of steroids. They like did this and that. You're gonna talk about the initial treatment, which no one ever gets a chance to do, right?
Methanol.
Pardon?
Yeah, supposedly,
It just placed in the methanol.
but I don't think, how do you know? Like, how do you know you drank methanol? I guess if you accidentally pick up a bottle of methanol and drink it and think, oh,
That's why I
God.
always keep a bottle
was
with
about
me.
the
I had some patients which they hooch and apparently if you burn a little bit and like bottle cap. If it's flame is blue, it's good, or it's a different color, you don't drink it. There was a lot of this, it's a whole hospital. It used to be in Boston Harbor, what was called Long Island. I live near it, and I visited during medical school, and it was all left over from the Prohibition. People went blind in Prohibition from bad.
That's what I've been, we have neighbors. It seems to be a thing now, distilling, home distilling, especially up in the Carolina Mountains.
Yeah, well, they have a whole show on it.
Yeah, and is that stuff can you make ethanol instead of, can you make
Yeah,
the
but you don't know
methanol?
what you're doing,
You can make methanol?
you're gonna
Okay,
get-
'cause my wife says not to drink it. I'm like, okay.
No, don't. I have a bottle of my patient.
We have it just sitting.
I've had it for probably close to 40 years.
You won't drink it.
No.
Okay. She's right. She's right about everything.
Dr. Cohen, why did this patient come to you?
Oh, just she was blind and thinking, what could she do?
2 years.
Her family. She came over to the US and they were thinking, see a doctor, maybe there's something for
You
her.
know why they do hooch now? All the counties up there are dry.
Oh, we're in the,
Yeah, I mean, you go up there,
The
you
former
want,
slave states.
you're on vacation, good luck to you.
This is true.
You can't find a bar.
Yeah. All right, go ahead.
So optic neuropathies, these are just some of the more common ones that I've underlined here, but there are many different causes. And there's some of those more likely ones that we would see.
Was the nasal at all?
But yeah, I guess nasal.
It's like
I didn't look into it,
We
but
get
some,
so much nasal like candy.
It's generic now too, so it's not even expensive.
Oh, really?
yeah. So this is methanol toxicity. So history is critical for diagnosing toxic optic neuropathies, especially substance use, medication history, dietary habits, bariatric surgery, hobbies, family history, peripheral nervous system sensory changes. And there's a way to kind of introduce, the substance use questions in a way that make people more likely to volunteer that information. I've Yeah.
How do you do that? It's like, I was doing coke the other day, like, wait, where do you get your coke? It's like, where do you store your heroin? I got a bunch of, how do you ask it in a way that makes sense?
I mean, from a like illicit drug standpoint, that's a little more dicey, but from I mean, for like alcohol, say like how much do you drink a day? Like a 6-pack, a 12-pack?
Okay, yeah, so you throw out high numbers.
Correct, and sort of casually, and there was, I remember last year or something, there was a patient here that had some mystery optic neuropathy and bilateral that one of the one of the residents who had graduated was seeing. They couldn't kind of figure it out, and they said their substance use history is nothing, and so I went and saw them and asked it in that way, and then basically drinks like a handle of liquor a day,
Oh, does it?
you know, so it's like,
Oh,
I don't know, I feel like the way you
phrase it.
ask it can, you know, have an impact. Nutritional deficiency and toxic insults are common together.
I remember my first week, my first month on internship, there was a patient we were trying to decide he was alcoholic, so we to cover him from detoxing. And he would never answer, no, he looked like an alcoholic, but he kept saying no, no. So I came in one morning, we asked him how he felt, and he said he felt top shelf. Which I never heard that expression. It's such a weird expression.
Yeah.
It means you feel good, like all the good liquors on the top shelf. So if you feel really good, top shelf, I'm like, I think we should cover.
Start see one.
Yeah, start some. Yeah.
So usually toxic insults are gradual, painless, bilateral, and symmetric. If it's rapid, consider methanol and ethylene glycol. Affects central vision early, color vision changes are seen. They can have photophobia and also poor dark adaptation. There should not be a relative afferent pupillary defect unless there's unilateral underlying pathology. And acutely, I guess you can see swollen and hyperemic nerves. And then in later stages, you'll see temporal pallor and then diffuse pallor. And for fields, they'll have a central or sequocentral scotoma. And I guess ethambutol can cause bitemporal hemianopsia. I think that's a forward thing. And then those
I have a patient with that. Do you guys, are there guidelines for ethambutol screening while they're on it? Do you know?
No.
Dr. Drucker says like 1 or 2 months after they begin is when they should. Or
And how
within-
often, like monthly or every other month?
There's no guidelines. We get this consult, they're like, please screen for down, it's all talking, we're like this, not a thing.
Right.
Yeah.
I did I had a lady with macular degenerations coming in anyway, so I just did nerve fiber scans on her, you know, every couple of months.
I think it might be something like every 3 months.
Mm.
It's more frequently than black vanilla or something.
Because it's pretty commonly used down here. And, yeah, I think.
Is it still MAC?
Yeah, there's
Okay.
a lot of that in Florida.
So then also, if someone has bilateral optic atrophy, it's reasonable to get an MRI, brain and orbits, to see if there's something compressive. And then there's 2 scans that we talked about. History guided nutritional deficiencies testing, such as based on what you discover in the history, and then the EP or ERG if there's any uncertainty. The treatment's pretty straightforward. If it's low, replenish it. If it's high, stop taking it. And then encourage a healthy diet, stop toxic habits that put the optic nerves at risk for further damage. And then that's particularly like I remember seeing a Weaver's patient in Dr. Drucker's clinic, and he smoked, 2 packs a day, a young guy, drank a lot, and it's just a recipe for disaster for his nerves. So then for methanol and ethylene glycol toxicity, you can give sodium bicarb for the anion gap metabolic acidosis. And then Alex said it, so ethanol is like a treatment in the acute setting, and basically the enzyme alcohol dehydrogenase that pushes methanol to its toxic forms like formaldehyde and formic acid. That first reaction, ethanol has a higher affinity for alcohol dehydrogenase, so basically clogs up the enzyme and prevents the rapid conversion to formaldehyde and formic acid, which is what causes the damage.
There's a great episode of House where a guy drinks a bunch of methanol and with like toner or his cleaner in prison. And then he's like, "You're gonna die, let's get drunk." And so he starts feeding him shots of tequila, and the guy starts feeling better. And he's like, "Oh, well, now you're not gonna die.
And he
You're
said,
going back to jail."
no, and he said, he's on
Yeah.
death row.
Yeah.
So he saves it so he can get electrocuted away.
Yeah.
The thing is, I think it's IV. I think you need IV ethanol and very quickly. So I don't know how. If doing some things with housework.
Beer is on
They use
formula.
ethanol to delay, birth, when you go into premature labor.
Oh, in the old days?
Yeah, so if you're in a plane between Europe and, America, go into labor,
Chug it
start
up.
drinking.
What, do you guys have do you know, I have a protocol for MRIs that you use, if you want to check the optic nerves, is it like fat, DSET, or T1, T1?
That's a good
You
one.
want to check out? I mean, these just say with and without contrast, and then looking at. Something. I mean, sometimes they're just pretty good inflammation, but.
It's like, do you say with and without contrast orbits?
Yeah. So
Yeah.
Dr. Drucker will say MRI, brain and orbits. I was actually gonna put it in here. MRI, brain and orbits with and without contrast, with careful attention to the optic nerves, tract and chiasm in their entirety. That's it. Okay.
Usually T1 is kind of more anatomy, and T2 shows more inflammation, shows more pathology.
But you just tell them to get the scan. 'Cause at one point, I was reading about fat desaturation for nerve, but then someone said you can't do fat desaturation in contrast, and